جديدة من تنمية صحة البالغين Abnormalities of Fecal Elimination. Abnormalities in fecal elimination are symptoms of functional disorders of disease of gastrointestinal tract. هاي الابنورماليتي تشمل constipation إمساك diarrhea إسهال and incontinence اللي هو السلس وعدم السيطرة. Constipation is abnormal hardening of stool that makes their passage difficult, sometimes painful, and decrease in stool volume or retention of stool in the rectum for a prolonged period. أسباب الconstipation medication أدوية the anticholinergic drug, antidepressant, iron preparation, antihypertensive, opioid analgesic. Rectal or anal disorders, hemorrhoid, basur, obstruction, bowel tumor, metabolic, neurologic, and neuromuscular condition مثل diabetes or multiple sclerosis. Endocrine disorders مثل hypothyroid, lead poisoning, and connective tissue disorders مثل SLE. Other causes هو weakness, immobility, عدم الحركة, dietary habit, lack of exercise, stress, chronic laxative use. Irritable bowel syndrome, diverticular, are common causes of the colon associated with constipation. Clinical manifestations: decreased bowel movement أقل من 3 times per week، يعني ما يروح الحمام أقل من 3 مرات بالأسبوع. يكون مصحوب معاه abdominal distension, pain and pressure, headache, decreased appetite, fatigue, indigestion, strain at stool, and elimination of small volume and hard dry stool, sense of incomplete evacuation. Diagnosis: one patient history, physical exam, barium enema or sigmoidoscopy to assess is it for spasm or narrowing of the bowel, anorectal manometry, هذا measure the change in intraluminal pressure and coordination of muscle activity in the GIT due to assess malfunction of the sphincter, rectosphincter reflex. Deepography. Complications: history, hypertension, fecal impaction, hemorrhoid, fissuring, megacolon. هذا complication of constipation. Medical management aim to correct underlying cause. علاج السبب by education to increase diet, fiber in diet, fluid, bowel training habits, and discontinuing of laxative use. Routine exercise that strengthen abdominal muscles. Biofeedback is a technique used to help patients learn to relax the sphincter mechanism to expel the stool. 6 to 12 teaspoons of unprocessed bran يعني نخالة laxative to be used. Use bulk forming agent مثلا saline and osmotic agent أو lubricant stimulant. Nursing management, patient education, how to prevent constipation, respond to urge to defecate, dietary information, increase ambulation and exercise, describe abdominal toning exercise, اللي هو contraction of abdominal muscles 4 times per day and link leg to chest. Instruct patient about semi-squatting position during defecation. الحالة الثانية إسهال diarrhea, increase the frequency of bowel movement أكثر من 3 per day، يعني واحد تطلع بطنه بالحمام أكثر من 3 مرات باليوم. increase amount more than 200 grams per day. altered consistency اللي هو losing of stool، يعني أما زيادة عدد مرات أكثر من 3 باليوم، أو إسهال يكون مائي، أو يكون حجم البراز أكثر من 200 غرام باليوم. هذا يكون معها associated with urgency, perianal discomfort, incontinence. Any condition that cause increased intestinal secretion, decreased mucosal absorption, or alteration in motility can cause diarrhea. Diarrhea may be acute or chronic. أسبابه causes irritable bowel syndrome, lactose intolerance. The main underlying cause of diarrhea. It occurs also from medications, the thyroid hormone replacement, laxative, antibiotic, chemotherapy, أو tube feeding formula, أو metabolic endocrine disorders مثل diabetes mellitus, thyrotoxicosis, viral or bacterial infections مثل food poisoning أو dysentery, nutritional and malabsorptive disorders مثل celiac, anal sphincter defect, Zollinger-Ellison syndrome, paralytic ileus, intestinal obstruction, AIDS. Clinical manifestation: increase the frequency and the fluid content of stool, abdominal cramp, distension, intestinal rumbling, anorexia, thirst, painful spasmodic contraction of the anus, and ineffective straining. Other symptoms are due to dehydration, electrolyte imbalance. Greasy stool يعني إسهال شحمي suggests intestinal malabsorption. Presence of mucus and pus suggests inflammatory enteritis or colitis. Oily droplet most indicate pancreatic insufficiency. Nocturnal diarrhea may suggest diabetic neuropathy. Diagnosis هو complete blood count, chemistry, urine analysis, routine stool exam for infectious parasite, barium enema, and endoscopy. Complication: dysrhythmia, muscle weakness, drowsy, anorexia, loss of fluid, cause urine output أقل من 30 باليوم, decrease potassium level less than 3 millimole per liter should be reported. Medical management: use of antibiotics and anti-inflammatory agent to reduce the severity and treat underlying disease. Nursing management: assessment in acute episode, encourage bed rest and food and fluid, low in bulk, solid food followed, avoid caffeine beverages and very hot or cold food, restrict milk products, fat, fresh fruit and vegetables for several days. Administer antidiarrheal medication, IV fluid, report evidence of dysrhythmia that may result from hypokalemia. Inflammatory irritable bowel syndrome هي functional disorder of intestinal motility, no cause, usually hereditary factor, أو psychological stress, أو depression, anxiety, أو diet high in fat and stimulating or irritating food, alcohol consumption, and smoking. More common in women than in men. In irritable bowel syndrome, peristaltic wave are affected by specific segments and intensity of propel the fecal pattern. No evidence of inflammation or parasite. Clinical manifestation: alteration in bowel pattern، هو يعني تتغير طبيعة الأمعاء، the primary symptom. Constipation or diarrhea, or mixing of both. Abdominal pain increase with eating and decrease with defecation. Bloating, انتفاخ, abdominal distension. Diagnosis: stool study, contrast X-ray, barium enema, colonoscope, electromyography, steady instrumental procedure, medical management, restrict food, and then reintroduction of food. Is important to determine type of food that is irritating. اللي هو البينز or caffeinated products or fried food or alcohol or spicy food. Stress reduction technique, management, diarrhea and constipation. Probiotic can be given, dietary complement. Nursing management, nurse should educate family and patient about the importance of good dietary habits, chewing food slowly and eat regularly, not take fluid with meal since it may cause abdominal distension, discourage alcohol and smoking. نجي على موضوع آخر هو acute inflammatory intestinal disorders، أمراض التهابية. أول شيء appendicitis، التهاب الزائدة الدودية هو inflammation of the appendix. Appendix تعريفه هو small finger-like structure within abdomen about 10 cm long and attached to the cecum, just below ileocecal valve. Full with food and empty into cecum. It is prone to obstruction and to infection, appendicitis. Common cause of acute abdomen، أحد أسباب حالة البطن الحادة and emergency abdominal surgery. Occur in all ages but common between the age of 10 إلى 30 سنة. Pathophysiology، it become inflamed and edematous either by being kinked or occluded by fecalith, tumor or foreign body. Inflammatory process increase, intraluminal pressure, initiating progressively severe generalized or preumbilical pain that becomes localized in the right iliac fossa. Then it is inflamed, it followed with pulse. Clinical manifestation, vague epigastric pain or preumbilical pain that progress to right iliac fossa or right lower quadrant يعني. Associated with low-grade fever, loss of appetite, localized tenderness at McBurney point اللي هو point between umbilicus and inferior superior iliac spine. Positive liver tenderness, positive Robsing sign, positive obituate and Sowers sign, and continuous hyperesthesia. If it is rupture, pain become more diffuse with the development of abdominal distension. Diagnosis طبعا complete physical exam, laboratory test, TBC urine analysis, abdominal X-ray, CT scan revealed right lower quadrant density or localized distension of the bowel. شنو أعراض الالتهاب الزائدة الدودية؟ perforation، برعس عندنا peritonitis، هذا occur خلال 24 hours of pain onset. abscess formation، portal phlebitis. medical management طبعا هو immediate surgery appendectomy. antibiotic if it is perforated drainage is obtained to abscess then appendectomy is performed. nursing management pre-surgery يعني قبل العملية relieve pain prevent reduce anxiety prepare patient for surgery. After surgery place the patient in high polar position or supine with legs slightly flexed. The analgesic opioid, give food as tolerated, teach patient about wound care, instruct patient resume normal activity within 2 to 4 weeks. Nursing intervention for patient with complication after appendectomy. peritonitis طبعا observe for abdominal distension, fever, vomiting, abdominal rigidity, tachycardia, employ constant NG tube, correct dehydration, administer antibiotic. المضاعفات الثانية pelvic abscess. Evaluate patient, chills, fever, diaphoresis, diarrhea. Prepare patient for rectal exam and surgical drainage. Subphrenic abscess يعني under diaphragm. Evaluate chills, fever. Prepare X-ray exam. Prepare for surgical drainage of abscess. Paralytic ileus. Assess bowel sounds. Employ nasogastric tube and suction. الحالة الثالثة هي peritonitis, inflammation of the peritoneum. The serous membrane lining abdominal cavity هذا peritoneum. Result from bacteria E. coli, Klebsiella, Protea, Pseudomonas, or from GI disease. In human occur from disease in reproductive organs. How it can be result from trauma or injury مثلا gunshot يعني إطلاقات نارية أو stab wounds اللي هو مثلا بالسكاكين أو الأشياء المخترقة or kidney inflammation. Other common causes هو appendicitis, perforated ulcer, diverticulitis, bowel perforation, peritoneal disease. Clinical manifestation depend on the severity and location of inflammation. Diffuse pain become constant, localized, more intense near the site of inflammation, increase with movement. Become severe tenderness and distension affected area, rebound tenderness, paralytic areas, increased temperature, increased pulse rate, diminished peristaltic movement, rigid abdominal muscles. Diagnostic finding: increased white BC, decreased hemoglobin hematocrit if blood loss occurred, decreased sodium potassium chloride, abdominal X-ray, air fluid and distended bowel, CT scan, abscess formation, peritoneal aspiration for culture and sensitivity. شنو أعراض مضاعفات البريتونيتس؟ هو sepsis, shock, intestinal obstruction. Medical management هو fluid and electrolyte replacement, analgesic, antiemetic, intestinal intubation and suction, oxygen therapy, massive antibiotic, large dose antibiotic طبعا IV, surgery to remove infected material and correct the cause. Nursing management: patient in ICU, monitor vital signs, GI function, fluid and electrolyte balance, urine output, assessment of pain, positioning of patient, record administration and monitor IV fluid, increase food and fluid intake gradually as needed, observe and record for drainage, teach patient and family how to care for a drain and wound of discharge. الموضوع الآخر هو intestinal obstruction, انسداد الأمعاء, or presence of a block that prevent normal flow of intestinal content through intestinal tract. عندنا two types of obstruction: mechanical, functional. Mechanical هو intralaminar or mule obstruction from pressure on the intestinal wall, مثلا انسداد بالتيومر, neoplasm, interception, hernia, stenosis, abscess, adhesion. Functional هو intestinal musculature cannot propel due to muscle dystrophy أو endocrine مثل diabetes أو neurological Parkinson, can be temporarily when bowel is manipulated due to surgery. Cause of intestinal obstruction: obstruction طبعا can be partial جزئي أو كلي complete. Severity depend on region of obstruction, degree of obstruction, degree to which vascular supply disturbed. Most bowel obstruction occur in the small intestine, adhesion, hernia, neoplasm. Other causes: interception, bolus, paralytic ileus. Most obstruction of large bowel occur in the sigmoid. common cause هو الكارسينوما, diverticulitis, irritable bowel disease or benign tumor. Interception هو invagination or shortening of colon caused by movement one segment of bowel into another, يعني تتداخل يسمون انغماد الأمعاء. Volvulus of sigmoid colon twisted and edema, التواء. Hernia هو herniated intestinal content, يعني فتق hernia. Small bowel obstruction, intestinal content, fluid, gas accumulate above intestinal obstruction. فيصير عندنا abdominal distension, retention of fluid, decrease absorption of fluid, stimulate more gastric secretion. With increased distension, increase intestinal pressure and decrease enough arterial pressure, edema, congestion, necrosis, perforation or rupture of intestinal wall. فيصير عندنا peritonitis. Metabolic alkalosis يصير عندنا dehydration and acidosis, loss of H2O and sodium. Hypovolemic shock due to acute fluid loss. Signs and symptoms: initially crampy pain, colic. Patient may pass blood and mucus, but no fecal matter or flatus vomiting. If obstruction complete, intestinal content propelled toward the mouth instead of the rectum. Obstruction of the ileum, fecal vomiting. Dehydration, hypovolemic shock. Diagnosis هو من signs and symptoms: X-ray, abnormal quantity of fluid and gas, lab study for electrolyte, CBC, or signs of dehydration. Medical management هو NG tube, نحط له أنبوب بالأنف for decompression of the bowel, surgery, and complete obstruction, repairing hernia, dividing adhesion or removing affected part, make anastomosis. Nursing management: maintain NG tube function, measure, assess output, assess fluid electrolyte, nutritional status, passage of stool or flatus, retain bowel sound, improvement in abdominal pain. Report increased abdominal pain or abdominal distension, increase NG tube, prepare for patient for surgery. Large bowel obstruction, سداد الأمعاء الغليظة, accumulation of intestinal content, fluid and gas proximal to the obstruction. Causes: severe distension and perforation. If severe obstruction يصير cut off blood, necrosis, يعني يصير موت الأنسجة, which is life threatening. Dehydration occur more slowly. Clinical manifestation: sigmoid colon and rectum obstructed only, constipation can be seen for months. Blood loss in stool, distended abdomen, crampy lower abdominal pain, fecal vomiting, and shock muke. Diagnosis أيضا من signs and symptoms: imaging study في الإكس-راي, abdominal CT, MRI. ملاحظة: barium study is contraindicated. Medical management هو correction of fluid and electrolyte, NG tube, colonoscope, rectal tube, surgery, cystectomy, colostomy. Nursing management هو monitor patient for worsening of obstruction, monitor IV fluid and electrolyte, prepare the patient for surgery.